Is cosmetic surgery different when it comes to men and women? Well, today Jason gets a tummy tuck and a male breast reduction here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Today on the show we're talking all about the male tummy tuck and chest reduction with a little bit of liposuction thrown in there. Although these are less common procedures, in men there are many males who experience weight loss or go through a dramatic change in their life and have excess skin that needs to be removed. Well, today Dr. Dunkley, our cosmetic surgeon, will be performing these procedures on our patient Jason. Welcome to the show, Dr. Dunkley.
Thank you, Troy.
Okay, let's get to this straight away because I want to knock this off at the top. What do you clinically call, because I call a male tummy tuck and a breast revision, and I know that's probably not correct. What's the clinical terms?
Well, you were actually correct. A male tummy tuck is a good way to refer to it.
Okay.
Abdominoplasty is the technical term, but it's the same term we use for women
Oh,
and
perfect.
Yeah.
Okay, step one.
Yeah, the chest reduction we can refer to in many different ways. That can be male breast reduction, gynecomastia surgery, or just chest reduction.
Okay, well, I sort of got one part right there. I wanted to say to you, Dr. Dunkley, make everyone aware at home that we brought Jason to you because he had an issue from a previous surgery. This wasn't your work. You've gone in to fix the problems.
Right.
Tell us a little bit about what you're fixing and why you needed to fix it to begin with.
Well, some of the things I noticed on Jason was, first of all, the incision line had spread apart a lot. So it hadn't been closed really well. And Jason actually said that parts of it actually came apart. So
before it healed?
Before it healed,
Okay.
yes. And this was years and years ago. But
Yeah.
what that results in is we get an indentation where the incision is, a really noticeable indentation. And then there were some other areas where there just wasn't enough liposuction or contouring done.
Is there ever enough liposuction, my friend?
Some people probably think not. But when you have a bulge where we want a concavity, it becomes pretty noticeable.
And while you were there, you said, I think Jason was the one who said to you, I wouldn't mind a little bit of liposuction on my chest area. Is that common for men to have that done?
Surprisingly, I'm getting a lot of patients
I
that
knew
want
you
that
were.
done. Yeah. Anytime you have a little extra on the chest, it just doesn't look good, especially in men who are going around, in a swimming pool at least, without a shirt on. And they can be self-conscious.
And the thing is with people who are still fit, who are still exercising every day, just have that little bit of excess skin. Is it the same type of procedure as what you would do on a woman for liposuction around that area?
No, it's pretty different than what we do on a
interesting.
woman. For a woman, we're doing a breast reduction. We're usually making some incisions in the skin to help remove excess skin. Most men, we don't want to make any skin incisions because it'll be noticeable and they'll have their shirt off. So we try and do it more with liposuction and then just removal of some breast tissue right under the nipple area.
Why are men coming in to having this done more with the chest reduction?
Well, I don't know. I think we're getting a little more fat and lazy than we used to be.
Well, men are becoming more vain and knowing that these are possible procedures.
Yeah, absolutely. There's a learning curve and people figure out, hey, I can do this, I can do this. And
well, I think a very good point that's going to be made throughout this show, especially when we go behind the scenes in your clinic with Jason, is that aftercare. Jason didn't really have a lot of great aftercare for him, hence why the stitches split. Am I talking in the right terminology here?
yeah, aftercare would be, all your follow-ups after the surgery. And you certainly need to keep close tabs on patients. And if they have any issues, I have them come back even more often so that we can address any problems.
So tell me a little bit about how you were performing the male tummy tuck compared to a female tummy tuck. Same?
Very similar.
Okay.
The only things that we consider on a male that might be a little different than women is we do want the incision a little bit lower typically. Women's swimsuits tend to come up a little bit higher on the sides, and the lower we keep the incision, usually the straighter the contour on the sides, and on men we don't want more of hourglass shape, we want more straight on the sides.
Interesting. Can you still transfer the fat that Jason had taken out of his chest area and put into like his cheeks if he chose to do that, or around the mouth like we have done on the shows before?
Yes, absolutely.
Still the same?
Still the same.
Okay. I understand. Well, Dr. Dunkley, thank you so much. We really appreciate it. Thanks for sticking with us on the show. Well, today it's all about chest reduction and a tummy tuck scar revision that our patient, Jason, is having done later on in the show. Dr. Dunkley, are there any type of complications that would come with this type of work that you're doing today?
Well, any surgery can have complications. For what we're doing on Jason, with the chest reduction, sometimes we'll see some little asymmetries from side to side. Sometimes the skin doesn't tighten up as much as we want, and there'll be a little bit of sag in the chest. Those could be problems, but not really complications, more just problems that can occur with the surgery.
Well, that's an interesting point that you're bringing out regarding sagging in the chest. What can you do to avoid that?
Well,
Is it something we need to do as the patient, or you as the doctor?
No, there's probably not much you can do as a patient. The surgery, if it does not take care of it with just liposuction, sometimes we'll do skin tightening treatments afterwards, or if that's not sufficient, we can come back and cut out some extra skin, but that leaves scars that I don't like to put on men.
Okay, so the majority of Jason's surgery was truly revision of the previous tummy tuck.
Correct, at least on the bottom part.
On the bottom part, and the liposuction on his chest. Where else were you doing the liposuction on his body?
We did a little more through the backside. You know, those dreaded love handles. Nobody really loves them, so we got rid of those a little bit.
All right, Dr. Dunkley, here's a viewer question. What about the results? Can men and women both expect their final results to last the same amount of time? I thought that was an interesting question.
And yes, they should expect the results to last the same amount of time. Now, the most important thing after any of these procedures, don't gain weight.
I was about to say that. And men have a step up because we don't have kids.
That's right. Our bodies don't go through quite as many changes as women's bodies do.
Okay, so bottom line, do expect the same results, but avoid major amount of food.
Yes. Keep at the gym, keep the weight off. Those are important parts.
Okay, well, here's something interesting, because we all know a tummy tuck scar is around the body.
Well, a tummy tuck scar should actually just be around the front half of the body.
So then why do we see it at the back?
Well, he had a total body lift, so that means you're going all the way around, or a belt resection. So a tummy tuck traditionally is just hip to hip, or maybe a little past, depending on how much loose skin there is. You get into a thigh, lateral thigh and buttock lift when you go all the way around.
Okay, interesting stat here for you. The number of men getting chest reductions has grown 29% since the year 2000. I think you answered that a little bit before, saying we're just more open to this stuff now.
We're more open to it. We might not be as good about getting to the gym as we should be, and so yeah, I'm seeing that exact change in my practice. More and more men coming in and saying, hey, doc, what can I do about this? I don't like it.
Well, I think I need to come and see you. Dr. Dunkley, thank you so much. Now let's go meet our patient Jason and listen to his story explaining why he is fixing a past surgery. And then we're going to see Dr. Dunkley in action. Stick with us.
My name is Jason, and I'm 39 years old, and I am having a male tummy tuck and a scar revision and a male breast reduction.
Hello, Jason.
Hi, how are you?
I'm well. How are you doing?
Thank you.
Excellent. Nice to see you this morning.
Thank you. About 20 years ago, I had lost a major amount of weight, and I had a lot of loose skin. And at the same time, we had discovered that I had an umbilical hernia, so I obviously had to have surgery for that. And while we were having that surgery, or when I knew I was going to have that surgery, I decided to consult a plastic surgeon to actually have the tummy tuck done at that time to remove some of the loose skin. We did do that. I had the hernia surgery and the tummy tuck at the same time. It was two different surgeons. One was for the hernia and the other was the plastic surgeon. And the results from that were fantastic. The skin was gone. I was very happy with the result.
We're going to revise this incision all the way around. And when you wake up, you're going to have a binder on and a vest. It'll provide some compression because we're also going to be doing the gynecomastia surgery, so a little liposuction on the chest and removal of that excessive breast tissue as well.
Okay.
So compression will help. That keeps the swelling to a minimum and just helps things to heal as quickly as possible.
When I had done that first surgery, I had noticed that looked great, but then everything else looked off. So I ended up having flank surgery and eventually basically was cut all the way around to reduce the appearance of the flanks.
Anytime we can take tension off of the skin edge, that's good. Tension tends to make the scar widen. And that's the other reason we talked about making sure we get a lot of layers closed underneath so that by the time we get up to that skin edge, there's very little, and hopefully none, as far as the tension goes.
Okay.
Hopefully no tension.
Okay. The reason I feel that the procedures that I'm having done now are, basically required is because over the course of time, the scar didn't heal the way I had hoped that it would. And it almost looks a little off balance to me. One side looks a little larger than the other, and I had gone back several times to have it revised, and it just never worked out the way that I had wanted it to. So I do feel that at this point in time, a surgery is, absolutely relevant.
And it takes us about an hour and a half per side.
Okay.
So, well, that's just for the scar, maybe another hour on the front one with the chest.
Okay.
So you're looking at about 3 to 4 hours of surgery.
Don't go away. After the break, it's time for Jason to go into surgery and have his mishaps from prior procedures corrected. Before the break, we learned Jason's story and the struggles he has gone throughout his life. Well, now we are going to watch as Dr. Dunkley gives him back a nice, shapely chest and tummy.
I know people at home might be, thinking to themselves that perhaps this is a bit superficial. However, I think it's really important for the person to feel good about themselves. And for me, this is something that is really important for me personally, to feel good about myself. And I think that this procedure will really help me have have more self-confidence in myself when I'm in that situation. I try to eat right to a degree. I exercise every day. There's certain areas of my body that are just not going to change without surgical help, and that's why I've decided to have this procedure.
His incisions before had been closed in probably too few layers, and so he developed an indentation under that scar. So we cut out the old scar and we recruited all the fat that we could get to bring those edges together.
My ideal goal after this surgery is to feel comfortable enough in a swimsuit when we're at the beach, or when we're at our pool or whatever, to just feel comfortable with my body. I don't necessarily feel uncomfortable with my upper body as far as the breast area like we were talking about, but I do feel uncomfortable with my scar, because the line of my scar is actually not even, and it does come above my bathing suit. So I would just like to feel more comfortable when we're at the beach or out in a situation like that.
The prior surgeon probably didn't do anything wrong, maybe a little inexperienced, maybe who knows, but he did tell me at one point that he lifted something and it pulled the incision apart, and then when that happens and it gets contaminated, we can't close it again or it will become infected, so it had to heal by what's called secondary intention. So this is the ultrasound device. Ultrasound energy waves travel down this metal probe. When it gets to these rings on the end, it causes them to disperse or focus right there. So though you can feel it along the length, you get the most dispersion of the energy right there at the tip. The
main reason I wanted to have this was for the scar revision, and it's kind of like I said with my first surgery, while we're there we might as well just do some other housekeeping as long as we're there. I feel that my breasts are a little larger than they should be. Now obviously they're not Dolly Parton breasts or anything like that, however, I would just like a little bit of reduction in that. So I spoke with Dr. Dunkley, and the procedure that we're going to do, I believe, is just a little bit of minor liposuction around each breast to help reduce some of the tissue in that area, and that's what we're looking at doing. Obviously, I think, in today's day and age, you're seeing a lot more males having, plastic surgery of some sort or some type of procedure done. It's a lot more common today than it was, say, even 10 years ago or 20 years ago when I actually had my first surgery.
You see we're getting a little bit of a ridge right across here, which is what we want. I want this to form, to revert.
Today, those very same people would, I wouldn't be surprised if they were to have something done. And there's nothing wrong with that.
Men and women are fairly similar. The feminine hormones, progesterone and estrogen, do cause the actual breast tissue to enlarge, and therefore women get larger breasts typically. But men have breast tissue just as well as women do. They can still get breast cancer as well. Come up here and feel this. Feel what a difference there is if you squeeze there versus squeezing this side.
Oh yeah.
Lots more over here. Remnants of that leftover skin where we did some liposuction not only in the chest but really through the sides. That skin's a little bit stretched out and we got as much fat out of there as possible, and of course we use our ultrasound device to try and get as much skin tightening as possible as well. I expect this new scar to be very thin. It's not under as much tension as it was the first time, and tension helps, will make scars widen. So because there's less tension, we should get a thinner incision or scar afterwards. This one I'm going to have to try and make sure we don't get a indent right there. It was big enough that it could leave a little deficit. These two are so small I'm not worried.
I can't say that I necessarily have any fear going into this procedure. As I've said, I've had several procedures done before. Obviously, I don't want to be Joan Rivers. You know, obviously that was a very tragic situation. That was a very serious situation. And, you know, definitely, you know, those, you know, that brought to light things that could happen. You know, I've never necessarily have been afraid of, you know, having surgery or going under. But I will say that kind of was a wake-up call, and it kind of makes you, you know, look at it, you know, with a second view.
Our patient today should feel pretty good. We used a lot of numbing medicine to make sure those incisions won't hurt right away. That will wear off in probably 2 to 4 or even up to 6 hours, at which point he's going to be more sore, obviously. He will be able to get up and move around. He shouldn't have any significant problems sitting, bending, because this was just a scar revision. We didn't do what we would do with the tummy tuck, which is repair muscles, bring those together in the midline. We didn't remove so much skin that we're making him extremely tight and he'd be bent over. So he should move fairly well. It'll definitely hurt. The first 3 days are typically the worst of it. Day 4, usually patients will wake up and say, I feel a little bit better than I did yesterday. And then progressively each day after that, they should feel better.
I'm turning 40 this year, and this is a procedure that I want to have done so I can feel on the outside the way that I feel inside.
Coming up, we'll sit down with Jason and the doctor to review the final results and see how Jason likes his new look. Well, here we are at the favourite part of the show, where we get to see the amazing before and after shots of Jason. Take a look. Jason, welcome, my friend.
Oh, thank you. Thank you for having
All
me.
right, when we look at your before and afters, what the?
Major difference, right? Dr. Dunkley did an amazing job.
Huge difference. Yeah. Let's recap what you had done many years ago and why you're here today.
Well, many years ago, I had actually had an umbilical hernia. And while they were in there, I thought, well, let's just do a little bit more. Because at the time, I had lost quite a bit of weight. And I did have some extra skin. So I wanted them to do a tummy tuck to fix the extra skin that I had with the umbilical hernia while they were in there doing that surgery.
So we had that done.
Right.
Didn't go too good after the operation, is that correct?
Well, the initial tummy tuck did go okay, actually.
Oh.
And then I continued to have surgery, and then I did the sides.
You
and the
became a
back.
little bit of a surgery holic.
You could call it that.
A little bit of an addict.
Okay, because when I first saw the images, the scarring was quite all over the shop, wasn't it? And we had quite a big indentation. Explain to me why that was.
You get an indentation when you don't close with enough layers. So we got to bring healthy fat together underneath the skin layer.
That makes sense.
If we don't have that fat there and you just close the skin, then you create kind of an empty spot, and as it heals, you'll get an indentation, which is just what he had.
Okay. I want to ask you a personal question, if you wouldn't mind. When you're standing there and you have your underwear on and you see that scar of the way it was, knowing you went in and elected to have the operation a few years ago, did you ever regret?
You know, I never did regret having the operation because my body had gone through so much transformation. I regret not taking the proper advice of the doctor at the time and being a little bit more cautious with my actions. I do regret that.
Okay, but now, seeing those after results, it's a huge difference, Jason.
It's a huge difference, and for me, the thing that I internalize is why did I wait so long to get it? Why did I live with it for as long as I did?
Well, you didn't know me.
Well, that's
Let's be real. It's
Let's
like
be
the
honest.
magic wand of the
That's
younger
true,
you.
that's true.
I introduced you to Dr. Dunkley. I said, get in there.
and the rest is history,
And
right?
the rest is history, I should say. When you were in there, you said, well, why not a little bit about my chest?
Yeah.
Did you know that you could have liposuction on your chest?
I actually did. It is something that I had wanted to do. However, though, in the past, I've heard a lot of horror stories of the results and things that could or could possibly go wrong, could or could not possibly go wrong. So I was a little apprehensive about it. But after meeting with Dr. Dunkley, I was very, very confident in his abilities, and I was quite confident that it would go well.
And Dr. Dunkley, result-wise, how do you feel about the results that you have now seen?
I'm really happy with it. When you first sent me the pictures and we were considering meeting with Jason, I was really surprised how obvious the scar was and how deep the indentation was. So now that I look at him, I mean, could it be a little more perfect? Possibly, but I'm really, really happy.
Interesting you say that. I could be a little bit happier. When you go in and correct someone else's work, is it true to say it's never 100% a gain? Can I be honest in saying that?
It's really, really hard to get it 100% perfect. We can always get an improvement, and sometimes quite a drastic improvement, but it's hard to get perfect.
Well, I have to say, Jason, when I saw your aftershots, I think it was almost perfect.
I did
and it was
too.
only you and I talking, and you went, well, I could have a little bit more. And that's us being a little bit picky, I would say. How do we reduce the scarring now on Jason?
So there's some important things you can do after surgery. There's many scar creams that work quite well.
Okay.
There's also silicone tape strips you can put over the incision. That helps a lot as well.
Mm-hmm. How do you feel about it now?
Looking
at it.
I feel it's amazing. It's the result was just absolutely amazing, and honestly, it's not been that long.
In about 2 weeks, I have most patients back at work. If you have a strenuous job, lifting, you need more time off. But in 2 weeks, if you're doing minimal activity, we can get you back to work.
Yeah.
It'll be 2 months usually before patients tell me, I'm 100% back, I feel great.
We loved seeing you go through this, and it's great to have guys on the show, Dr. Dunkley, that are happy to open up about it. Nobody should have to settle for a body that they're not happy with. If you have had prior surgery that did not give you the results you wanted, then you should seek out a cosmetic surgeon like Dr. Dunkley that can discuss your possibilities for you. For more information about the show, head over to theyounger.you.tv, and I'll see you next week.